Did you know that a small vitamin can have a big impact on your health? Do you feel tired all the time? Do you have trouble concentrating? Today we will talk about vitamin B12 and the visible signs that could indicate that you are not getting enough and your body needs a little more of this essential vitamin. Vitamin B12 is essential for many functions in our body, from the production of red blood cells to the health of our nerves. Vitamin B12 plays a crucial role in numerous biological processes, highlighting its contribution to DNA synthesis and the formation of red blood cells. These components are essential for cell growth and oxygen transport in the body. However, despite its vital importance, the human body is not capable of producing vitamin B12 on its own. Although our body cannot produce it, we obtain it through our diet, mainly from foods of animal origin such as meat, fish, eggs, and dairy products. However, absorption of this vitamin requires intrinsic factor produced in the stomach, making some people more susceptible to deficiencies. Furthermore, this vitamin, being water-soluble, is not stored in large quantities in the body, making regular intake necessary to maintain adequate levels. This can lead to a vitamin B12 deficiency, which the body will show in several signs that we will talk about in today's video. These could be signs of a vitamin B12 deficiency. Pay attention! 1. Increased heart rate. When the body lacks vitamin B12, one of the first warning signals it sends is an accelerated heart rate. This physiological response is actually a survival mechanism. Vitamin B12 is essential for the production of red blood cells. These tiny cellular carriers are responsible for distributing oxygen throughout the body. By decreasing the number of red blood cells due to B12 deficiency, the body faces an emergency situation. You need to ensure an adequate supply of oxygen to the tissues, especially those that are most demanding, such as the brain and liver. To compensate for this lack of red blood cells and ensure that vital organs receive the necessary oxygen, the heart increases its heart rate. That is, it beats faster to pump a greater amount of blood each minute. In this way, it attempts to maximize the delivery of oxygen to the tissues, despite the decrease in the carrying capacity of the blood. 2. Appearance of bruises. Ease of bruising is a sign that may indicate a deficiency of certain essential vitamins. In addition to vitamin B12, both calcium and vitamin C deficiencies can weaken blood vessels, causing them to break more easily and causing bruising. Therefore, if you notice an unusual increase in bruising on your body, it is advisable to consult a health professional to rule out any nutritional deficiencies and receive appropriate treatment. 3. Pale and yellowish skin. One of the first signs of a B12 deficiency is pale, yellowish skin. This is due to anemia, a common condition associated with a lack of this vitamin, which prevents the body from producing enough red blood cells. This vitamin is essential for the production of red blood cells, which are the cells responsible for transporting oxygen to all cells in the body. When there is a shortage of vitamin B12, red blood cell production decreases, leading to reduced tissue oxygenation and, as a consequence, pale skin. 4. Fatigue. Vitamin B12 is essential for the production of red blood cells, the blood cells responsible for transporting oxygen to all the cells in our body. When there is a deficiency of this vitamin, red blood cell production is compromised, resulting in decreased oxygen transport. This reduction in the supply of oxygen to the tissues causes a feeling of chronic fatigue and general weakness, since our cells do not receive the energy necessary to carry out their functions optimally. 5. Glossitis. If you notice that your tongue is swollen, red, and painful, it could be glossitis, another sign that you need more vitamin B12. This vitamin is essential for the health of cells in the mouth. Glossitis is a condition in which you feel burning in the mouth. In addition to the tongue becoming soft and the taste buds disappear, the tongue becomes red, swollen, and painful. Various scientific research has established a direct connection between glossitis, an inflammation of the tongue, and low levels of vitamin B12 in the body. These studies suggest that deficiency of this essential vitamin can trigger inflammatory processes in the tongue tissue, manifesting in the symptoms described above. Glossitis may be an early sign of vitamin B12 deficiency, a condition that, if left untreated, can lead to more serious complications. Therefore, it is essential that health professionals be attentive to this clinical manifestation and perform appropriate diagnostic tests to confirm or rule out this nutritional deficiency. 6. Blurry vision. Vitamin B12 plays a crucial role in the health of our nerves, including those that transmit visual signals to the brain. When there is a deficiency of this vitamin, damage to the optic nerve can occur, resulting in blurred or distorted vision. However, there is good news. This visual problem is usually reversible. By supplementing the diet with vitamin B12 supplements, it is possible to restore optic nerve function and regain clear, sharp vision. 7. Distorted hand-eye coordination and balance. Vitamin B12 deficiency is not limited to eyesight. This nutritional deficiency can trigger a series of neurological problems, significantly affecting the central nervous system. When we perform a task that requires hand-eye coordination, such as catching a ball, writing, or drawing, our eyes send information to the brain about the position and movement of the object. The brain processes this information and sends signals to the muscles in the hands to move in a coordinated and precise manner. Vitamin B12 deficiency can compromise balance and coordination, making everyday tasks associated with hand-eye coordination difficult. This is a rare symptom, but unfortunately medical science does not have enough conclusive evidence to know if this symptom is reversible. 8. High temperature. The hypothalamus, a small region of the brain, acts as an internal thermostat, constantly adjusting bodily functions to maintain optimal balance. This endocrine control center coordinates the release of hormones, influencing processes as diverse as appetite, sleep, body temperature, blood pressure, and stress responses. Upon detecting imbalances, such as a vitamin B12 deficiency, the hypothalamus activates compensatory mechanisms, such as increased body temperature, to restore homeostasis. 9. Nervous system problems. Vitamin B12 plays an important role in your nervous system, as we just mentioned with the hypothalamus in the previous point. This deficiency can cause several nerve-related problems, one of them being a tingling sensation followed by trembling hands and feet. If you are vegan, you should include at least one source of B12 in your diet. Almond-based milk is a good option. 10. Difficulty breathing. This occurs mainly in those who have an anemic condition. Vitamin B12 deficiency can cause a number of health problems, including difficulty breathing. This vitamin is essential for the production of red blood cells, which are the cells responsible for transporting oxygen to all parts of the body. By not having enough healthy red blood cells, the body is deprived of the necessary oxygen, which causes fatigue, weakness, and, in more severe cases, difficulty breathing. This situation is usually aggravated in people with pernicious anemia, a condition in which the body cannot adequately absorb vitamin B12. Luckily, it is not so common, but it must be taken into account that there can be many causes for difficulty breathing. If it is a vitamin B12 deficiency, it will be reversible. The indicated thing is to take vitamin B12 supplements and do some breathing exercises. 11. Irritation. Vitamin B12 deficiency can manifest itself in various ways, with irritability being one of its most common symptoms. This vitamin plays a crucial role in the metabolism of homocysteine, an amino acid that, at high levels, can affect brain function. Without enough vitamin B12, the body cannot properly process homocysteine, which can lead to a buildup of this substance in the brain and, consequently, to mood swings and irritability. When there is not enough vitamin B12, the brain will have an overload of homocysteine, which could lead to mental health problems. 12. Stomach problems. Vitamin B12 deficiency is an alarm signal for our body. By not having enough red blood cells, our tissues, including the intestine, do not receive the oxygen they need to function properly. This lack of oxygen prevents the intestine from performing its functions optimally, which can manifest itself with symptoms such as diarrhea and nausea. 13. Weight loss. We all like to control our weight and stay slim, but weight loss due to vitamin B12 deficiency is not something to be happy about. On the contrary, it is a worrying situation. Red blood cell deficiency, by affecting stomach health, can trigger a series of symptoms such as loss of appetite and a considerable decrease in abdominal circumference. This condition, known as anemia, interferes with the body's ability to transport oxygen to tissues, including those of the digestive system. 14. Irrationality deficiency of vitamin B12, essential for the production of red blood cells that carry oxygen to all cells in the body, including the brain, has significant cognitive consequences. When the brain does not receive enough oxygen, its functioning is compromised, manifesting in a decreased ability to think clearly and logically. This can translate into difficulties concentrating, problems making decisions, and, in more severe cases, memory loss. Additionally, scientific studies have established a connection between low levels of vitamin B12 and mood disturbances, suggesting that mental health may also be affected by this nutritional deficiency. 15. Mood swings. Emotional fluctuations are a normal part of life, but we often seek to understand their underlying causes. While there are numerous factors that can influence our mood, recent research suggests that vitamin B12 deficiency could be a factor to consider. This essential vitamin plays a crucial role in the production of neurotransmitters, chemicals that regulate mood, sleep, and other cognitive functions. By maintaining adequate levels of vitamin B12, we can contribute to homeostasis, that is, the optimal balance of our body, which translates into greater emotional stability and improved general well-being. 16. Hair changes. Vitamin B12 also plays an important role in hair health. A deficiency can cause dry, brittle hair and hair loss. It is an essential nutrient that not only contributes to hair beauty, by helping to produce red blood cells, there is more oxygenation to the scalp, keeping it healthy, which in turn stimulates the growth of strong and shiny hair. A diet rich in vitamin B12 can help prevent hair problems such as dryness, brittleness, and excessive hair loss. If you notice that your hair is falling out more than normal, consult your doctor. 17. Brittle nails. Nails can also be an indicator of a vitamin B12 deficiency. Your nails can be like little windows to your internal health. If you notice that they have become brittle, ridged, and break easily, it could be a sign that your body is not getting enough vitamin B12. This essential vitamin plays a crucial role in the production of red blood cells and the maintenance of tissues, including nails. 18. Mouth ulcers. Although not the only cause of canker sores, vitamin B12 deficiency may be a contributing factor. Vitamin B12 plays a crucial role in the formation of red blood cells and is essential for tissue health, including oral tissues. B12 is necessary for the repair of tissues, including those that line the mouth. A deficiency can weaken the immune system, making you more susceptible to infections, such as those that can cause mouth ulcers. How are mouth ulcers related to B12 deficiency? When there is a deficiency of vitamin B12, tissues can become inflamed and damaged more easily. This can manifest as mouth ulcers. These painful sores can appear on the tongue, lips, and inside the cheeks. If you experience any of these signs, it is important that you see your doctor for a proper diagnosis. Risk factors for vitamin B12 deficiency. Vitamin B12 deficiency can have multiple causes, and it is important to know the risk factors in order to prevent it and detect it in time. For this, it is important to recognize which groups are at greater risk of B12 deficiency. Strict vegetarians and vegans. As we mentioned, the main source of vitamin B12 is foods of animal origin. Strict vegetarians and vegans who do not consume any animal products are at greatest risk, unless they take supplements or consume foods fortified with B12. Infants and young children. Babies who are exclusively breastfed can develop B12 deficiency if the mother has low levels of this vitamin. Older people. The ability to absorb vitamin B12 decreases with age due to changes in the stomach and small intestine. Once the risk groups have been described, it is also advisable to know about certain health conditions, pathologies, and medical procedures that can cause vitamin B12 deficiency. Crohn's disease. This inflammatory bowel disease can damage the small intestine, affecting the absorption of nutrients, including vitamin B12. Celiac disease. In this autoimmune disease, the intestinal villi are damaged, making it difficult to absorb nutrients. Atrophic gastritis. This condition is characterized by inflammation and atrophy of the gastric mucosa, which reduces the production of hydrochloric acid, necessary for the absorption of B12. Pernicious anemia. It is an autoimmune disease in which the body attacks the stomach cells that produce intrinsic factor, a protein essential for the absorption of vitamin B12. Liver diseases. The liver plays an important role in the metabolism of vitamin B12, and liver diseases can affect this function. Bacterial infections. Some bacterial infections, such as fish tapeworm infection, can compete for vitamin B12 in the intestine. Medications. Those used to treat heartburn and ulcers can reduce acid production in the stomach, making it difficult to absorb vitamin B12. Medications for type 2 diabetes can interfere with the absorption of vitamin B12. Some other medications, such as anticonvulsants and antibiotics, can also affect vitamin B12 levels. Bariatric surgery. Weight loss surgery can alter the anatomy of the stomach and small intestine, affecting the absorption of nutrients, including vitamin B12. Intestinal resection. Removing part of the small intestine can reduce the absorptive surface area and cause vitamin B12 deficiency. How is B12 deficiency diagnosed? If you suspect you might have a vitamin B12 deficiency, it's important to consult your doctor. He will look for some of these visible signs and proceed to perform a blood test to confirm the diagnosis. How is B12 deficiency treated? To increase your B12 levels, you can include more foods such as meat, fish, eggs, and dairy in your diet. You can also consider taking vitamin B12 supplements. In some cases, injections may be given. Remember, vitamin B12 is essential for your well-being. If you suspect you may have a deficiency, consult your early diagnosis and proper treatment can help you feel better quickly. Tell us about your experience. Have you suffered from B12 deficiency? How have you fought it? We read you in the comments. If you found this video useful, give us a like and share it. Someone might need it. Thank you for joining me. I invite you to subscribe to the channel so you don't miss any health and well-being content. See you soon!